We request everyone to please have a seat. సాంగ్ వాళ్ళని కూడా తొందరగా రమ్మంచుకోండి, ఇప్పుడు పిలుస్తున్నాను. Everyone, please have your seats. Okay. So, honorable dignitaries from the Ministry of Health and Family Welfare, Government of Andhra Pradesh, implementation partners, and all the participants, good afternoon, one and all. I am Nagendra Gavala, State Maternal Health Consultant, Government of Andhra Pradesh, supported by UNICEF. On behalf of Government of Andhra Pradesh, we welcome you to the inaugural ceremony of the first batch of NPM training in the state of Andhra Pradesh. Let's begin the event with the national song and welcome performance by the students of College of Nursing, Guntur. Please come.
Vande Mataram, Vande Mataram, Sunjala Sufala, Malayaj Sitala, Sasya Syamala, Mataram, Vande Mataram, Subrajyotsna Puragidayamini, Pullakusumita Drumadana Shobini, Suhasini, Sumadura Bhashini, Sukadam Varadam Mataram, Vande Mataram, Vande Mataram.
Thank you. Thank you, students. Please have a seat. So now I request a welcome performance from the students. Mic open. Mic. Thank you so much, students, for that wonderful performance and for adding cultural flavor to this ceremony. Now, on behalf of Government of Andhra Pradesh, I wholeheartedly welcome you all for this inaugural ceremony. I welcome our Commissioner of Health and Family Welfare, Andhra Pradesh, Shri Bhaskar Katamneni, sir, and our Joint Collector, G. Raja Kumari, and ADG Nursing from Ministry of Health and Family Welfare, and Dr. Evita from Fernandez Foundation for gracing the occasion. I also welcome Dr. Siddhar, MCH Advisor, and Dr. Dilip, INC President, and Mr. Luigi, Chief of Health, UNICEF India, who have joined us virtually to this inauguration. I also welcome all the officers from the state and the district officials, including the developmental partners and associations like Foxy, SOMI for attending this program. Lastly, I would like to congratulate all NPM trainings for being a part of this first batch of training, and I welcome them for this inauguration and for the training going forward. Now, I would like to request our Commissioner of Health and Family Welfare, Shri Bhaskar Katamneni, sir, to the dais, please. Welcome you, sir. I request DD Nursing to please present the bouquet. Now, I request Joint Collector Guntur, Shri D. Kumari, onto the dais, please. Now, I request Dr. Rati Balachandran, ADG Nursing, Ministry of Health and Family Welfare, onto the dais, please. Now, I request Dr. Vijaya Gauri, Regional Director, Guntur, onto the dais, please. Now, I would like to welcome Dr. Evita, Chairman, Fernandez Foundation, onto the dais, please. Now, I would like to welcome Dr. Salima, Health Specialist from UNICEF Hyderabad Field Office, onto the dais, please. We also welcome our regional and state and district officials, Dr. Anil Kumar, Additional Director, NCH, and our DMHO Guntur, Dr. Esmin, and MS GGH and HOD of GGH, and Deputy Director Nursing, Dr. Wali, onto the for this occasion. We also welcome the dignitaries who have joined us virtually: MCH Advisor, INC President, Chief of Health, UNICEF, and Foxy and SOMI representatives. Thank you everyone for joining this occasion. Now we request our Chief Guest, Commissioner of Health and Family Welfare, and the dignitaries on the dais to lighten the lamp and start the proceedings formally. Yeah. So we request you to light the lamp along with the guests. UNICEF Learning Center and YouTube లో టైప్ చేయమని చెప్పండి. Thank you, sir, and all the dignitaries on the stage for lamping the light. With an aim to provide quality childbirth care to our mothers and to ensure care with dignity and promote positive childbirth experience, Government of Andhra Pradesh launching this prestigious nurse practitioner in midwifery program. Now we request our Commissioner, sir, to launch the brochure which outlines the need for the midwives, scope of work, and expected outcomes from the NPM. Yes, sir. Cesarean.
laptop pin share.
We thank God and Almighty for this day to come true. And we are very happy to have this midwifery initiative program with a hardship, taking a travel and journey in this pandemic for the past 2 years. Even then, the challenges are being overcome by our directorate and with the commissioner's help. And from the Indian Nursing Council and Government of India, we could able to see the day is colorful. The day should be so colorful in all the mothers who are being there, who will be giving birth to the children. Why this midwifery initiative? Like in our country, in India, if you think, we should go back and see some of the background data about the midwifery things. So when you look into this, there are certain critical challenges for reaching sustainable developmental goals. One is that we have to ensuring the quality and see that there are services, but the quality is being lacking, and we need to ensure the quality of the services and we need to see that the trained human resources are being available for each and every community person to take the midwifery care. And we need to address the raising of the cesarean sections, the abdominal deliveries, the natural vaginal deliveries are been coming down and cesarean sections are been coming up. So we need to address this issue, means we need to strengthen and make the mothers to have the natural deliveries and natural birth preparedness and other things. And we need to reach all the remote areas and urban places and ensure the maternity care that is being provided and is being gained by the mother and the family should be a respectful maternity care. The mother and child should be safe in the hands of the healthcare providers. What is the need in the midwifery in India? If you look into it, it provides access to the quality of the maternal and newborn healthcare, and it needs to promote the natural birthing. Most importantly, the experience of childbirthing should not be a painful one with the pain of the abdominal surgery and post-operative period and a long period in the staying in the hospital. It should be a positive childbirthing experience for the mother, and it should reduce the over-medicalization, and we need to promote the respectable maternity care. Most importantly, we need to identify the complications and problems of the mother and child in the early stages itself before they could experience the very severe complications and refer them. With that, what we can do means the healthcare services can be cut down. The cost of the healthcare services can be reduced. The National Health Mission that was been keenly focusing on the areas of National Health Mission on the maternal and child health. Most importantly, operationalizing the first referral unit in the community. Majority of the people, 80% of the people are being in the community and in the field. The services at the first referral unit should be strengthened, need to be built up in such a way that they could be able to identify the abnormalities or the deviations and also promote the normal deliveries for the mother. New maternal and child health wings need to be there. And for the complicated cases, obstetrical high dependency units and intensive care units are also being required in the hospitals in the tertiary, secondary and tertiary level. As such, the capacity building initiative was being taken up with the various programs like Dakshata training program and also antenatal care strengthening programs such as Pradhana Mantri Surakshit Matritva Abhiyan, and is been going on like that continually. Despite of tremendous progress, nearly 32,000 pregnant women each year still lose their lives. Why? It may be during the pregnancy or childbirth or in the postnatal period. Each and every year it is going on adding. In addition, 5,90,000 newborns are been dying every year in the first month of life with some or other complications during that period. The additional efforts are being needed in India, especially to increase the universal health coverage and to achieve the sustainable developmental goal for maternal and newborn and also for the child health care. The National Health Policy in 2017 has aimed in reduction of maternal mortality ratio to 100 per lakh live births by 2020. When you look into the background, 46% of maternal deaths and 40% of the neonatal deaths have been occurring around the time of the labor, that is before the labor, antenatal period, during the labor, and even soon after the labor. It is because the lack of trained service provider and over medication of the delivery process, not having a positive approach towards the natural delivery. And this global evidence is strongly recommending that midwifery-led care providers and women-centric care and promotes the natural birthing. We need to provide the care towards the mother-centered care. Why does India need midwifery? Yes, there is a study in 2014 that it notes that 87% of services can be provided by midwives. See, 87%, that means it's a great percentage. We require a review has also made midwifery-led continuity models versus the models of the care for the childbearing woman in 2016 has provided an evidence that midwife-led continuity of the care can result in a 24% reduction in the preterm births, a significant reduction in the C-sections, episiotomies, instrumental births, and also use of pain relieving while increasing the psychological support for the woman. Most importantly, the mothers are lacking, the services are lacking a personal touch and interpersonal relationship. This psychological support to the mother makes the mother to go for a positive childbirth. Countries like Sweden and Sri Lanka also back midwifery for investing heavily in the midwifery care along with the good referral system. So a midwife in the community can take a challenging role in referring them in the early stage. When you look into the midwifery-led care units, a collaborative care model to be established in all the teaching hospitals, medical colleges, district hospitals, and also community health centers and area hospitals. where all the pregnant women to be screened by the doctors, obstetricians, and those without any complication, they are being allowed to a midwife. The first sitting, the first side, they can be tackled, they can identify and they can register and they can continue the care throughout the pregnancy and make them to have a normal birth for the mother. To establish this midwifery-led care units, that will be mostly promotion of physiological birthing and avoiding unnecessary C-section. And when you look into the risk profiling, it lowers the risk cases to be managed by the midwife. High-risk cases need to be managed by the medical and obstetricians. That one should not forget. People may be thinking, and there are certain false ideas that once the midwife comes, the nurses will take up. What will happen to the complications or when the crisis occurs? No, it should not be that way. The myth has to be corrected. Midwife will be providing a supportive care and identifying the problems and immediately timely referring them and seeing that they takes care by the specialist, giving scope for the obstetrician to focus on the complicated cases. It also lowers the load on the medical officers and the obstetricians. When we look our overall strategy, we are operationalizing in our state. We thank our government for state midwifery training institutes in all the government colleges. 10 BSc nursing colleges are there across the country. We are having at present 6 midwifery educators per institute need to be there. At present, we are having 6 members, and we have been initiating this program at Guntur now, where we have been having and enjoying this pleasure, and also at the Tirupati simultaneously. And we want to create a pool of 60 midwifery educators so that these 60 midwifery educators can be able to tackle and meet our need. Our goal is mainly creating a cadre of nurse practitioner midwifery who are skilled, who can able to have the competencies of ICM, and they are knowledgeable, they are capable of providing compassionate, women-centered reproductive, maternity, and newborn healthcare services. When you look into the objectives, there are various objectives. Most important one is that the quality maternal and newborn health services, and we need to promote the natural birthing. We need to promote the respectable maternity care in the labor rooms or in any other places. When the woman comes, receiving the woman pleasantly, those behavioral changes need to be there in our nurses. The nurses need to be very friendly and need to feel that the atmosphere is a very conducive atmosphere and friendly atmosphere where the mother and the family members will not feel a threat. Or the case went inside, they may go to the cesarean section. That fear should not be there. They should be prepared for the normal and other better. How midwifery services will be organized? We are going to organize through the midwife-led care units. Now we are very happy in India. Nurse practitioners in midwife in India was been started with 18 months of course, where the GNM, General Nursing Midwifery, and BSc Nursing candidates, those who are having 2 years of experience are being selected. After step-by-step selections, they were being placed for undergoing a training of 1.5 years in State Midwifery Training Institute. After their training, they were then posted in the high-load cases of the deliveries, where they will be providing the care 24/7 without losing any mother or child in the teaching hospitals and also district and area hospital. We need to promote and conduct the physiological normal births, and as a part of it, there are been various components in this care like antenatal care, postnatal care, and safe abortion services also. So these are the things that are being taken up in 1.5 year course for the nurses who are already trained by the General Nursing Midwifery and who has been completed their graduation in nursing. They will be provided this training program. After the certification and examination, the State Nursing Council will register them, and they maintain a live register of NPMs, and every 5 years they need to renew their registration, and they will be given the next position in the midwifery. As per the Indian Nursing Council Act, the midwifery nurse practitioner midwifery program regulations are being released 2020 on 6th January 2021 by the President of Indian Nursing Council, Dr. Dilip Kumar. So we are mainly focusing, there are 4 ICM essential components. Competencies are being there. In the first competency, these are the general competencies for everybody, for the general public. In the second one is the pre-pregnancy and antenatal. Third one is the care during the labor and childbirth, and ongoing women and newborn care. These are the various aspects. I welcome and I congratulate all the trainees who have been entered for this NPN program. We give a round of applause for all of them for coming forward, making this initiative to be a colorful event. Without you, we cannot have the program having the digital or having the material, having the knowledge. The trainees and you people need to come forward. We expect many more people will be coming by looking your services and your knowledge that will be reflected in the community. Thank you for giving me this opportunity. Thank you, one and all. We wish you good luck and we congratulate the principal of Government College of Nursing Guntur and Government College of Nursing Tirupati, and also all my paternity nursing people. Thank you, one and all. And we also thank for all the press and all the other people who have been attending this program, making it very colorful. Thank you, one and all.
Thank you so much, Dr. Murali, for sharing the objectives of this program and showing us the way forward. Now I invite Dr. Evita, chairperson of Fernandez Foundation, who is spearheading this midwifery program in National Midwifery Training Institute, Hyderabad, to speak a few words about the concept of midwifery and share her experiences on impact of a midwife that could make in improving the outcomes of maternal and neonatal outcomes. Over to you, Dr. Evita.
Good afternoon. Mr. Bhaskar Kamnani, Commissioner Health and Family Welfare, Dr. Sikdar, Advisor, MCH, MOH, FW, Dr. Rati Balachandran, ADG Nursing, Dr. Dilip Kumar, INC President, Dr. Haimavati, Director of Public Health, Ms. Raj Kumari, Joint Collector, Dr. Vali, Deputy Director Nursing, Mr. Luigi of UNICEF, and we have some of our NPM educators from the first batch from Andhra and who completed their 26 weeks of training, representatives from other development partners, Somi Foxy Press, and of course the new batch of NPM trainees. Good afternoon. This is indeed a very historic moment for Andhra Pradesh, and we at Fernandez Foundation are privileged to be a part of this event and to join you in this today. Thank you for this opportunity. I have been asked to share my thoughts on the concept of midwifery. I want to remind this audience that I have been a hardcore obstetrician for more than 20 years when I discovered a lot of hard truths about midwifery. I was looking after only pregnant women my entire professional life, and I thought every pregnant woman needed an obstetrician, but I was wrong. Today, I stand before you with the firm conviction that every pregnant woman should first see a midwife, and only if required, should see an obstetrician. I want you to remember these words and carve them in your hearts for the rest of your lives. Why do I say this? 75% of pregnant women are essentially healthy and do not have major medical complications. These women can be cared for by midwives who are trained to global standards. When these women are in the hands of midwives, then research today has shown, and we have absolutely no doubt about it, that these women are looked after very well, and the care that they are given is as good as the care that you would receive from an obstetrician. In fact, these healthy women, when they are in the hands of midwives, the risk of a cesarean is less, the need for blood transfusion is less, the need for forceps or epidural is less, and these women have a positive birthing experience, so they are very happy with their birthing. And even more interesting, the data has shown that babies born in this population looked after by midwives have a better APGAR scoring. So there is less chance of babies having hypoxia. So why would we not invest in midwives? But who is a midwife? If you look at the word midwife, it means with woman. And that is the job of a midwife. She has the responsibility of taking a woman right to the journey of motherhood. So she looks after her through her pregnancy, labor and birth, postpartum up to 6 weeks, helps her with breastfeeding problems, and gives her advice on family planning methods. Now, to do this, a midwife has to be highly skilled to be given this quality of care. She is accepting the responsibility of 2 lives. So when we are talking about midwives, we are talking about very competent, highly skilled healthcare professionals who are going to be colleagues working collaboratively on an equal footing with obstetricians. Midwives are not haath ke niche assistants. They are professional, accountable colleagues. They offer sound advice on nutrition. They prepare women, give them antenatal classes, preparing them for labor and birth. They show them different exercises about how to be fit. And these women come in labor with so much confidence and determination to have a normal birth. So when you have midwives, your normal births will start increasing. And this is what you see now in Telangana today, where out of the many districts, we have midwives who were trained in 2017, posted in clusters in area hospitals, district hospitals, and the number of normal births has increased, the C-sections have come down, and the women are asking for midwifery care. So what happens to the obstetricians? The obstetricians now can focus on those women who need our help, all the complicated pregnancies. The midwives do the normal births, so the obstetricians can then perform a cesarean when it is necessary, and they can do it calmly, knowing that we have excellent midwives in the labor ward taking care of the other women. So what is India looking at? The collaborative care model, where we work in collaboration with mutual respect and trust in each other. So this way, the women are happy, the complicated pregnancies are looked after very well in collaboration with midwives. And the unique thing about you midwives is you are there to support women. When women come into labor, you are there with her for 6 hours, sometimes 8 hours throughout your duty. So you've built a relationship of trust. And that is why she would be absolutely happy in your hands. And this is why there's so much responsibility placed on you. The midwife gives her that continuity of care. As an obstetrician, I come into the labor ward, I spend 5 minutes with that mother. I ask her how she is, I examine, I give instructions, and I go away and I sit in the outpatient clinic, or I may be doing an emergency cesarean, or I may be scanning. But who is looking after that woman during that time? It's the midwife. And if it is an uncomplicated pregnancy, it is your privilege to birth that woman. because now she trusts you. So we need midwives in our birthing rooms. The philosophy, the heart of midwifery is built on one simple fact. Midwives believe that women's bodies are built to birth. And therefore, you believe that this woman can birth naturally. And you are trained to take care of normality. So if there is any deviation from the normal, you pick it up. You recognize complications before they become problems where the mother's life is in danger. That is why countries that have got midwifery as the backbone of their services, their maternal mortality and infant mortality ratios have reduced. So the government of India has made a firm commitment, and we've got Dr. Rati Balachandran here physically as ADG to promote this very cause. And that is why the training period after your nursing is minimum 18 months. It's not a shortcut method of 2 weeks, 3 months, but 18 months. Why are we so worried about a positive birthing experience? And I will end on this note. Why is WHO talking about a positive birthing experience? Why is International Confederation of Midwives and Government of India talking about positive birthing experience? Those of you who are mothers in this audience will remember every aspect of your birthing experience. And if you have been treated with disrespect and you have been alone with no birth companion, frightened, then that has led to a traumatic birth experience, leaving you depressed, afraid of having another baby, and sometimes emotionally scarred for the rest of your life. As midwives, you are there to support this woman, give her the privacy, the dignity she needs, and give her compassionate, woman-centered care, even if she has a forceps delivery, even if she has a cesarean, she will walk out of that hospital happy because she knows that she was respected, she was given choices, and the best was done for her. And where there are midwives, there are birth companions. So my plea is believe all you trainees who are going to start, you are the flag bearers for Andhra Pradesh. People are going to look at you. You are the first batch. And this is a wonderful opportunity for you. I congratulate and thank Mr. Bhaskar for taking this amazing step forward and launching the program today. As an obstetrician, I am convinced and I wish each one of you all the best. Thank you.
Thank you so much, Dr. Evita, for your kind and inspiring words on what midwives can contribute in improving the maternal and neonatal outcomes. Thank you so much. Now, we would like to invite Mr. Luigi, Chief of Health, UNICEF India, to address the gathering with a special focus on support extended for rollout of midwifery services at both at national and state levels. Over to you, Luigi.
Good afternoon. Can you please confirm whether I'm audible?
Sorry, Luigi, can you please repeat?
I'm asking to confirm whether you can hear me, please.
Yes, loud and clear. Please proceed.
Beautiful. Okay, so let me at the outset wish a good afternoon to all the key dignitaries on the dais and the ones who are also connected remotely, and more in particular to all of you in the room. I want to take you from where Dr. Evita stopped. She said to you, I'm convinced that this is a great initiative as an obstetrician. I'll take you from there and say, not as an obstetrician, not as a doctor, as a father who was for 3 times in the labor room on the side of his wife, assisting to birth with midwives in 3 different places of the world, I am entirely convinced that this is the way to go, experienced. We have the Lancet, we have the science, I bring my personal voice as well. So the babies of Andhra Pradesh will be in your hands very soon. So congratulations, please take this as an incredible opportunity and responsibility. I really wish you all the best for this course. And I really plea each and every of you in the room to give your best, because we are building another piece of the future of the babies and the women of India, and also another piece of the primary healthcare system of this country. Taking a step back, of course, you have heard it from Dr. Ratti, from Dr. Revita. don't have to add much to that. There is science, there is logic, there is rationale. There are countries across the world that have already been working at midwifery. India embarked on this. Sorry, sadly, COVID-19 has slowed down the journey, and this has been regretfully something that has affected much. But we're now at a stage where both in Andhra and in other states, and I know Dr. Sikter is there, he will speak to that, more is happening and more is planned. At the end of the day, and apologies if you hear some noise at my back, this is completely unplanned. At the end of the day, what we're looking at is the right of every woman and of every child to give birth, have birth, and have good life after that. So be it a mother, be it a baby, they have the right to have a good start of life, and then not to get sick after birth, and to be respected and taken care of before, during, and after birth. And as said before, birth is a purely natural event, and we need to deal with it with all the expertise that is required, but also as a natural thing, and as much as possible. And that is where you will come soon after being going through the training to help make this happen, and help use specialist doctors where and when they are needed. And otherwise, you and other midwives like you will be able to do the job perfectly. As UNICEF, what can I say? We have been involved at the center of this program from the outset. I think from 2016, well before I arrived here, some of the work started with the Fernandez Foundation, with the Ministry of Health. And after that, I am very grateful and glad to see that evidence brought interest, and the government of India took this program to a national program. We as UNICEF continue to support this effort in Andhra, as well in Telangana, as well in other states, and nationally. And we will continue to do so, because we firmly believe that it is a key turning point for the health system of India and for the well-being of women and newborns. With these few words, I again thank you all, wish you best of luck, and I hope to be able to come to see you during your trainings anytime soon. Best wishes, and thanks again.
Thank you. Thank you so much, Luigi, for giving us an overview on UNICEF support and commitment towards implementing midwifery services in India. Thank you so much. Midwifery initiative is a momentous movement, and the Indian Nursing Council, under the leadership of Dr. Dilip, played a key role in formulating the scope of practice of nurse practitioner midwifery educators and nurse practitioner midwives guidelines with a group of experts. Now, I request Dr. Dilip, President of INC, to address the gathering with a focus on scope of practice for the midwives in India. Over to you, Dr. Dilip.
Good afternoon to all of you. Good afternoon to all of you. Am I audible?
Yes, very much clear.
Okay. Greetings from the Indian Nursing Council. Distinguished dignitaries on the dais, distinguished invitees, distinguished participants, distinguished newly selected 60 nurse practitioner midwives, and my friends and colleagues. First of all, I would like to congratulate Mr. Bhaskar, Government of Andhra Pradesh, Commissioner, for taking this big initiative, and you will be the first in the country launching this nurse practitioner midwifery program. Indian Nursing Council believed since inception that there is a need to have the nurse practitioner midwives a post-basic program so that they will be effectively assisted in delivery, conducting the deliveries, and they will be in the safe hands as Dr. Evita was pointed out. We came in a long journey, and today is a very historic day for the nursing and midwifery fraternity in India. And especially, it is so unique that 2022, we are launching this program in India. How it is unique? 2020 is happened to be the International Year of the Nurse and Midwife. World Health Organization declared the 2020 as an International Year of the Nurse and Midwife to commemorate 100-year birth anniversary of the Florence Nightingale. Unfortunately, because of the COVID-19, we could not celebrate the euphoria. Therefore, World Health Organization extended this International Year of the Nurse and Midwife to 2021. So just completed 21, and we are starting rightly, because very rightly, why I'm mentioning this very important point, that for the first time, World Health Organization came out with a state of the world nursing report in 2020. 2021, International Confederation of Midwives and the World Health Organization and the UNFPA and the JAPAGO, they all came out with the state of the world midwifery report. These two very important global reports captured the 4 important themes. Number 1 is an investment. This is the theme of these 2 reports. Number 2, the creation of the nursing position. This is very important for the nursing and midwifery fraternity in India, because without creation of the positions, n number of the specialty curriculums are not going to make any headway until unless if you don't create the positions. Number 3, leadership. Number 4, leadership and delivery of practice. So these 4 themes very captured in these 2 important reports. And last year, 2021, 28th May, World Health Organization, World Health Assembly passed a strategic direction of the nursing and midwifery 21-25, SDNM. This is a very important resolution coming out from these 2 important global reports and captured as a resolution. And after 10 years, the agenda came to the WHO in 2021. That's how this SDNM resolution has been passed. Now the WHO has shared with all the countries for the implementation. The midwifery is a very important component in that. There are a lot of issues, and the issues and challenges and opportunities have been reflected. Now it is for the nursing and midwifery professionals and the government of India and the state governments to implement these reports, so that ultimately, as the Director General of the WHO said, without nurses, without nurses and midwives, you cannot achieve the universal health coverage. That is the basic statement. I think, therefore, this launching of the nurse practitioner midwifery program is very befitting, and we have to congratulate, and not only congratulate government of Andhra Pradesh, and also congratulate all the 60 newly selected nurse practitioner midwives. You have a long way of 18 months training to complete this NPM program. You will be the first the NPMs in India. We had a lot of, I think many of our nursing and midwifery fraternity will be remembering how we had an allergy for the word of the nurse practitioner. I think, so we are seeing at least golden day. I think the nurse practitioner critical care program is also has come into the existence with the support of the government of India. So now we have 2 nurse practitioner programs the Indian Nursing Council has laid down. And I think during COVID-19, many of the ICU's intensivists were talking to me how this nurse practitioner critical care program trained have came into handy in dealing during COVID-19. So coming to this scope of practice, I think you know that existing Indian Nursing Council Act, we don't have a component of the scope of practice in our act. So therefore now Government of India has already finalized the bill for introducing in the parliament. Shortly they are going to be introducing the parliament. It is called National Nursing and Midwifery Commission. In that new national bill, there is a component of the scope of practice. This scope of practice, once it is there included in the act, then the commission will have a authority to come out with the various issues and challenges that nurse practitioner midwives are going to face, and will have a legal empowerment for the nursing and midwifery fraternity with this scope of practice, which we have included in the draft bill. So in that perspective, which is very important nowadays, the awareness of the public in the health issues are very high. So therefore, we have to be practice safely. We have to protect the patients, and the nurses and midwives are the advocates for the patients and taking care of the safety of the patients. So therefore, the scope of practice for midwifery educators and the nurse practitioner midwives is very significant. So as I said, this I think I would like to congratulate the National Health Mission in consonance with the whatever the global report which has mentioned about the investment. I think I'm very happy to see with my 30 years working in the Ministry of Health, I am able to see the first time the investment, though the allocation of fund for the national development of nursing services was to the tune of 3,200 crore in the 11th 5-year plan, started with 40 lakhs in 1994, and we were able to get the 3,200 crore budget for the development of nursing services. So in that way, I think a policy statement was made by the NHM that during the year 2018, that it is a big policy announcement by way of they have made a commitment. They are going to train 86,000 nurse practitioner midwives in India. It is a big policy commitment because training of 86,000 and putting in the practice in the midwifery-led units, and it's going to be a big investment, which at least policy announcement is there. This is again in tune with the State of the World Nursing Report, the recommendation. It is an investment. So this is an investment which is coming in a big way by the National Health Commission for training and placing the nurse practitioners. And also the introduction of midwife-led care units are going to be established, and nurse practitioner, midwife educator and NPM curriculum developed. I think we had recently we had a NPM educator training program from EVTA Foundation. And those, I think the 6 people who have been trained from that institutions are going to the faculty in these 2 newly identified institutions for training the NPM people. And one of the important component has been included in the curriculum, focuses on transformative change in midwifery education and practice. I think the definition of the nurse practitioner midwife in the Indian context, which has been reflected in the NPM curriculum, and nurse practitioner midwives is one who has successfully completed the 18 months nurse practitioner in midwifery training program designed by the Indian Nursing Council based on the International Confederation Midwives Essential Competencies for a basic midwifery practice and recognized in India by the Ministry of Health and Family Welfare, Government of India, and who will be the registered and licensed to practice midwifery in high case load facilities across the country under the title Nurse Practitioner Midwife upon demonstrating competencies in the practice of midwifery. This is the operational definition with the sitting with all the stakeholders. We have come out with this definition. Nurse practitioner midwives is responsible and accountable to professional providing the respectful maternity care. It is one of the new, the important focus has been laid down in the whole curriculum, not only in our in the NPM curriculum. We have integrated in the BSc, newly revised BSc nursing curriculum also, and also the NPM is functions primarily in midwifery-led care units alongside the comprehensive emergency, obstetric and neonatal care centers. And NPMs also promotes normality during pregnancy, labor, birth, and the postpartum period, and early and timely detection of complications, carry out first-line emergency measures, refer and facilitate access to medical and surgical care. This has actually taken this evidence, what the Lancet has given, the 83% of the deliveries can be prevented if you have a midwifery-led units. On the basis of the International Confederation of Midwives, I think we'll be able to take care of these issues. In the scope of practice, there are the boundaries on which our NPM has to function. So these are the boundaries which has been laid out in the scope of practice. The NPM has to educate and counsel women and their families, because she is the one person who is going to stay with the 24/7 in different shifts. So she is the one who is going to closely be with the pregnant mother, and counseling is one of the very important component of the nurses, and caring is one of the core function of the nurses and midwives. So therefore, they will be the right people to counsel the women and their families, and she's and also advocate for women needs, autonomy and agency, order and interpret certain diagnostic procedures and laboratory tests which are required for that period, prescribe selected medications. I think this has been discussed in length and breadth with all the stakeholders, and you will be finding which are the drugs you will be able to give as a collaborative model. Access and triage women at their time of the admission and refer when necessary. Provide care for women and their newborns according to the best evidence. Consult with the refer to the other professionals and services. Document and review provisions of care. I think documentation is one of the very important. Now with the digitalization of the digital India, I think documentation is going to be very important and also very easy to, so that we'll be able to have a important evidence-based nursing and midwifery practice while working in the clinical setting. The scope of practice thrust areas, the pre-pregnancy care, sexual and reproductive health, antenatal care, care during labor and birth, that is intrapartum care, ongoing care of women and newborn, that is postpartum care. The additional roles and responsibility for the midwifery educators, because they are going to be the very important people who are going to stay with the NPM students. So they have to play a dual role of imparting training to the NPM at state midwifery training institutes alongside performing clinical practice themselves. This is one of the very important components which have been reflected here, because in India, at least nursing and midwifery practice, higher the education, we are away from the patient. This is one of the nursing model, but whereas in the medical model, higher we go, you are closer with the patient. So therefore, we are now trying to bridge this gap between the education and practice. Already the CMC model has been, at least for the Indian Nursing Council, with a lot of support with the St. John Medical College, the hospital, we were able to implement this dual role where so that component which we have been incorporated in the whole NPM. so that they will be working and also they will be teaching, so that they will be knowing the latest concepts and the protocols in the clinical level, so that while teaching, they will be able to integrate for an effective teaching learning process. And also they will supervise the nurse practitioner midwives during their clinical practice session, mentor and handhold the NPMs during and after the training. I think mentoring is one of the important component has been included in this whole program. And recently we had a framework has been developed, the mentoring framework, and shortly we are going to finalize that mentoring program. All the 6 midwifery educator people who have been just trained, I think they need to be they need to be mentored, so that shortly we are going to finalize with all the stakeholders. So that mentoring is one of the important elements which has been added into this program. As Evita Fernandez was mentioning, a collaborative care, this is a model, the nurse practitioner, midwifery, nurse practitioner, critical care, all nurse practitioner programs with the Indian Nursing Council is developing future. So they are all in a collaborative model. So effective collaboration between the nurse practitioner, midwives, obstetricians, pediatricians, and medical officers in charge. So that's how we have to collaborate while working in the clinical setting. Involving in care of women with high-risk pregnancies, pregnancy-related complications, and women newborns as part of the multidisciplinary team. So we are working as a multidisciplinary. We are not, because some people have a different concept of the practitioner means no, nurse practitioners is a collaborative model, working in the multidisciplinary approach. Overall accountability rests with the obstetricians, medical officer in charge of the hospital and health center. So we are working within the 4 walls of that institution, so that the patient is well protected. The details included in the SOP, you will find, I think this document is already is there. I think if it is not there, I think it needs to be printed, and each student should be given this scope of practice, so that she will be, the day one, she is fully aware of the what is by scope of practice, and she will be able to understand, and while doing her training, it will become more effective. The annexure 1 of in the document, it covers list of laboratory tests that can be ordered, how she can order, what are the tests, medication that can be prescribed with the NPMs, the procedural competencies that nurse practitioner midwives can perform independently, and which are the procedures she can practice in a collaborative or refer it to the higher level. Annexure 3B, maternal and newborn condition that an NPM can perform independently and also in collaborative model, and initial management of the complication as per the national guidelines. So again, definitely the midwives are going to save the lives of the many pregnant mothers, and they are going to play a very important role in achieving the sustainable development goal, where the India is one of the signatory in the United Nations for achieving the sustainable development goal, and hope this will be a landmark initiation of launching this nurse practitioner that becomes easier for other states also to follow this model and to implement the NPM program in other states. Wish you best of luck. Congratulations for the new 60 NPMs who have taken the initiative of joining this course. Wish you best of luck. Thank you very much.
Thank you. Thank you so much, Dr. Dilip Kumar, for taking us through the scope of practice for the midwives in India and for detailing the role of INC with respect to this midwifery. Thank you so much. So now we request Dr. Rati Balachandran, ADG Nursing, Ministry of Health and Family Welfare, one who is passionately working towards integrating this midwifery cadre into the public health system, to address the participants and share a few thoughts. Over to you, Dr.
Thank you. Warm greetings from Government of India. Respected Sri Bhaskar, Commissioner, Health and Family Welfare, dignitaries from Directorate of Medical Education, dignitaries from Directorate of Health Services, Andhra Pradesh, Dr. Evita Fernandez, Dr. Dilip Kumar, President, Indian Nursing Council, Dr. Sigdar, Advisor, Ministry of Health and Family Welfare, Government of India, just the principals of government nursing colleges of Andhra Pradesh, resource persons, and dear NPMs who have joined this journey today. First of all, let me congratulate you for taking this decision of advancing your knowledge in midwifery and take a more responsible job of a nurse practitioner midwife. As all the speakers before has spoken, this is a responsible, accountable role. Here you are helping the mother to pass through different stages to have a memorable experience of positive childbirth and helping them to take decision to have a natural birthing process. Birthing is a normal physiological process, but the condition can worsen at any point of time. So skillful watch is very important. Prompt action is important. Every mother has the right to have a respectful pregnancy and delivery. As we all know that India is one of the signatory for Sustainable Development Goal, and we have a great target to achieve that. We have high maternal mortality rate, which has been continuously reducing by the effective interventions of Government of India through the maternal health services and the modifications in that service. We also require midwifery for both maternal health as well as child health. Children are the future of the nation, and a healthy baby is the product of good antenatal care. And this, through the midwife, what we really want is a continuum of care, right from pre-pregnancy onwards, throughout the pregnancy, during labor, and during the postpartum, so that there will not be any scope of problems or complications. If at all, that can be managed immediately with the prompt action of midwives. That is the objective of all these efforts. Midwifery services in India has started long back, since 2000. Various agencies have come forward, supported, and we have put the initiatives from 2002 onwards. We have done it in pilot projects in West Bengal and Gujarat, and we have learned many lessons from that also. Over this period, the different parts, India itself is a wide diversity is there in terms of health indicators, health services, and the human resource available. We have 50,000 obstetricians to meet the needs of the country. But we were depending more on doctors and obstetricians for normal pregnancy, which has led to medicalization, over-medicalization, and increased cesarean section, which is having an impact on both the mother as well as the child. By having these midwifery services, we are helping both the mother and child to pass through this normal natural birthing process, so that long-lasting impact will be there in the health of the baby, and keeping the mother and the baby and the family at the center with the protective hands of midwives to protect them. And then comes the all other healthcare providers. That's the vision. Every delivery point to have an internationally competent midwife to be available. That's the journey where we have to reach. That's our ultimate goal. During the launch of nationwide comprehensive guideline for midwifery services, that is in 2018, in the platform of when the Government of India has initiated in the Partners Forum, we have calculated around 86,000 midwives are required, that is to provide care at the CHC levels and above. But our ultimate goal is to create internationally competent midwives, not only to meet the needs of our country, globally, we should be the leaders, and nursing has to lead world nursing services. The Indian nurses and midwives have to lead world nursing and midwifery services because we have a dividend of young age group here. By 2050, the vision of India is to be the #1 in the world. And I appreciate and congratulate the government of Andhra Pradesh, and especially the commissioner, to launch the first NPM training after this nurse educator program. Without much delay, you have utilized the competencies which they have gained to practice. This leadership and initiative is really a role model for other states, and we are also following it. To start in the tertiary hospitals under central government, we are also thinking of starting midwifery services in the tertiary hospitals so that very good collaborative training can be possible. Every delivery point be collaboratively managed by a midwife as well as an obstetrician. So with that words, I once again congratulate the nurse practitioner midwives who have joined today, and I wish you a great success, and we all are there to support you. Through various platforms, we are trying to bring experts with whom you can interact and clarify your doubts. I request you to utilize these resources to the maximum and save the mother and children, because by doing that, you are not only protecting the country for the next generation, for the generation after that also. By having a healthy child, we are ensuring the future of the nation for the next generation also, next century also. So thank you very much for having me here among you. And again, once again, I congratulate the team and wish you a great success.
Thank you so much, Dr. Adi, for giving us an overview of midwifery services and the way forward of midwifery program in India. Now, we would like to invite Dr. Sigdar, Advisor MCH from Ministry of Health and Family Welfare, who played one of the major roles in devising the policy on midwifery services in India. We request you to address the gathering. Dr. Sigdar, sir, over to you.
A very good evening to the esteemed audience. Shri Bhaskar Katumani, Commissioner Health and Family Welfare, Government of Andhra Pradesh. Dr. Hemavati, Director Public Health, Government of Andhra Pradesh. Dr. Dilip Kumar, President, Indian Nursing Council. Dr. Rati, ADG Nursing Staff of the Midwifery Training, Staffs of the Midwifery Training Institutes at Guntur, and SMTI Tirupati, representatives from the Fernandez Foundation, UNICEF, ladies and gentlemen joining virtually or in person. I bring to you greetings from the Government of India and on my personal behalf. At the outset, I really wish to thank the state of Andhra Pradesh for inviting me to speak on the day of the launch of this particular midwifery training for selected NPM trainees at the State Midwifery Training Institute, College of Nursing, Guntur. I can see that a lot of people are present on the dais and off the dais, and that's really something very heartening to see that people are now coming out of their lockdown phase and really participating with a lot of energy in all these meetings. And from now onwards, I believe and hope that all meetings will be physical so that the meetings actually provide some dividends in the sense of achievements. And also, it is with immense pleasure I would like to acknowledge the fervor and the zeal of the state of Andhra Pradesh, its policymakers, officers, and service providers for taking quick and firm steps for embarking upon this visionary journey of creating an NPM cadre in the country. I see in it a beacon of light for this NPM cadre, which has been hanging for quite some time, and we don't really have a cadre in the country. Can the state of Andhra Pradesh then lead the rest of the country in really coming out, or rather notifying an NPM cadre, which will be a harbinger and precursor for other states to follow. On the part of the Government of India, a major chunk of the technical and financial investment has gone into the strengthening of the College of Nursing's development of curriculum, scope of practice and recruitment, IEC materials, branding, travel and training of midwifery educators and nurse practitioners in midwifery, etc. Not only this, some significant and crucial advocacy efforts has also been undertaken to bring all stakeholders, partners and donors in sync with this agenda, which undoubtedly is going to result in a monumental impact on the future of maternal and neonatal health or outcomes in our country. Not to mention, the pandemic has been the biggest hurdle, but together with the support of the state governments, we are happy to share that the first batch of midwifery educators, including those from the state of Andhra Pradesh, have graduated in December last, and the next batch shall be commencing very, very soon. Hopefully by the 1st of next month, we hope to start the next batch, and we hope that many more midwifery educators for the country will be trained and empowered to provide services as well as training across the country. I would like to emphasize that the pandemic could not in any way dampen our spirits and urged us on to strategically plan our roadmap in midwifery. Rather, the Government of India, in collaboration with the partners, utilized this time and carefully scrutinized and screened and brought the international midwifery educators on board to kickstart training at various NMTIs of the country. Now, this process is at a very advanced state, and very soon we are going to be able to functionalize many designated NMTIs. And if all goes according to plan, then 2022 would be the year of midwifery in India, and I have no doubts on that. Trainings conducted by these international midwifery educators is of paramount importance when it comes to providing and establishing sanctity of the midwifery practices by the NPMs as per the International Confederation of Midwife Standards. Today, as the state of Andhra Pradesh opens a new chapter on maternal health, and especially the midwifery front, I congratulate the state, but also concurrently underline the importance of onboarding IMEs at the Tirupati NMTI at least, before commencing the training of the midwifery educators. Then, and only then, the NPMs trained in the state at these two institutes shall be adept in ICM competencies. Without the international midwifery educators, the effort may be ineffectual and definitely not as per Government of India policy. More important, the branding may not be there. So that is something in today's age, branding means a lot, and it is of huge importance. So whatever be the case, at least the initial batches, we have to have the blessings of the international midwifery educators. And that is one area I know for certain that you, Andhra Pradesh, will really take quick actions. There is no dearth of support for you, and you have got partners present on the ground. And I earnestly hope that you take this partner support to quickly have this IMEs in place and try this, or rather attempt this particular endeavor with renewed vigor. Nevertheless, I wish you much success and hope from now on, midwifery practices and processes shall prove to be the central to the concept of promoting natural birthing with quality, dignity, and respect, and also to curb the skyrocketing cases of cesarean sections in the state. All of you know that Andhra and Telangana are the states where the cesarean section rates are the highest in the country. And that's not something to be very proud of. That being the case, midwifery probably is the way out for all these states where the rates are very high, to immediately or quickly bring down them to the normal birthing level. Having said that, I'd also like to put across my message to the midwifery educators from the state, as well as the NPM trainees who are being trained here. And I urge that while practicing midwifery, you must empower the expectant mothers to make informed choices, to be vocal of her preferences during childbirth, and thus be advocates of their own health. Because as a midwife, you shall be her companion during her most memorable journey towards a safe motherhood. I would have loved to be physically present to stand with you in solidarity for this momentous step on which you are embarking. But unfortunately, on account of heavy preoccupations in the ministry during this PIP times and the parliament time, that was not possible. However, I'm eagerly waiting to see the state's accomplishment on the midwifery front, and also hope to witness trainings in full swing in the not too distant future. And in the end, the Government of India applauds and salutes the dedication of the state healthcare providers and frontline workers for their unwavering efforts during the pandemic, a lesson which really emboldens us to never give up under any calamity, because no calamity, howsoever big, is able to subdue our indomitable spirit. I thank you all for a patient listening.
Thank you. Thank you so much, Dr. Siddharth, for sharing the vision of Government of India on midwifery services. And also, thank you for accepting our invite and joining us for this inauguration virtually. Thank you so much. Now, we would like to invite our chief guest of this occasion, Shri Bhaskar Katamneni, Commissioner of Health and Family Welfare, Andhra Pradesh, who always strives for excellence, which is well demonstrated through our various achievements in the health department of our state, and is extremely committed to further improve the maternal and neonatal outcomes of the state. He has been the driving force in our state to implement this nurse practitioner midwifery program. We request you, sir, to address the gathering.
Yeah. Yes, sir.
Yeah, good afternoon, everybody. Srimati Rajkumari Garu, Joint Collector of Health and Development, Guntur District. Dr. Rati, ADG Nursing of Ministry of Health, and Director of Health, Vijay Gaur Garu, and Dr. Elita Fernandez from the Fernandez Foundation, Dr. Salima from UNICEF, and those people who are joining virtually from Delhi and different places, Mr. Ruki, Dr. Dilip, Dr. Sikdar, and other officers, Dr. Anil who has been with us, and then DMHO, Dr. Yasmin, and Dr. Valigaru from the DMA's office, taking care of the nursing. It's quite an happy occasion in the sense that maybe after 2 years we are stepping outside. The last 2 years we were all been mostly confined. For me also, though I was Commissioner of Health for the last 2 years, I think the first occasion I have stepped out of the office because we had to manage COVID, and then the circumstances were not right to basically come out. And then today also marks the occasion where in the state of Andhra Pradesh we have removed all restrictions. So yesterday midnight onwards, early morning of 16th, all restrictions were removed with the exception that people should wear masks. Now there are absolutely no restrictions on whatsoever kind of activities. So it is a good occasion that we start the department of activity with such a momentous occasion. It's a happy occasion for us in the sense that in fact we were waiting for the start of the course. In fact, there were days where I would get impatient. When are the educators coming out of the institute? And week after week, I would ask my officers, when are they coming out? So finally, that occasion has come. Of course, we only have 6 people. Ideally, we would require at least 60 at any point of time to take care of the task at hand. So from the mother's point of view and from the health point of view, a lot of speakers before has told, the kind of C-section that we have in this state, I can only speak about Andhra Pradesh, my state, is absolutely on the really bad side. I will not mince words when I say that, for different reasons. The one reason being that what I have found in my practical experience is that the number of obstetricians available, both government and private sector, is also not really sufficient. What would happen is that for even a normal case, a normal delivery for an obstetrician to handle, wait for 5-6 hours for a normal delivery, has really become an issue. So C-sections are becoming a norm in the sense that the patients to sit with the mother, take her through the entire process is really becoming a luxury. So today only the very well educated and very affordable mobile people are thinking about having a natural birth through going through the process and all. So that has become an issue. So worldwide, 80% of deliveries are normal deliveries, but unfortunately in our state, it's almost like 55-45, and in some private sector, it has been really bad. In my career, I've seen certain private nursing homes which have not done a normal delivery for a decade. 10 years, there are hospitals, 10 years they have not done a normal delivery. I used to wonder, even the law of averages says that 5 accidents of normal delivery should have happened in this hospital. No. Because in fact, this subject has been passion for me. Even when I was not in the health department in the district, I used to do, for record, I have reviewed every maternal death and every infant death during my entire period. Not even a single case I've missed. There were a lot of learning from that. One of this learning was that our obstetricians don't have the time. They don't have the time because there are very few people available. And it takes almost 10 to 11 years to produce one obstetrician and a lot of cost involved. So the system is not able to produce so many obstetricians and gynecologists required. So now, worldwide in the Western countries, the midwife practice is a well-established practice that has been done. And a lot of countries, which we call, I wouldn't say advanced countries, there are some set of countries which we call more than advanced countries, the so-called Scandinavian countries, which are all slowly moving mostly towards the midwifery. That we need to and take it forward. That being the thing, today is a good start. First baby step. It's a first small step. There is absolutely a long way to go. So my figures are like, for the state of Andhra Pradesh, we would require at least 4,000 midwife practitioners, half of them in the government sector, half in the private sector. So we need to start working on at least ensuring that we have those 2,000 midwives in the government sector. So the availability of nurses and staff nurses in the government sector, parallelly we are working. So otherwise what would happen is that if I take too many staff nurses out of the system and go fully into midwife, I would be depriving the other issues and other sets in the system. But I'm happy to announce that last year I've added 670 staff nurses. This year I'm adding another 4,000 staff nurses additionally into the state of Andhra Pradesh. So that these numbers will be added. So whatever numbers we are training today, or will be training these 2,000 staff nurses out of the government system, will be replenished by more people coming into or doing the regular non-obstetric kind of activities. So there are enough people available. So currently we are in the middle of recruitment. So in fact, for the last 2.5 years and going forward, we have recruited something like 35,000 new persons into the health department, which is roughly around 28% of the total staff. That is the kind of new people coming in. So the senior nurses available need to be trained on the midwife role. And then why it becomes really important that we have already discussed. Now, a little bit for the nurses who have chosen to come for training. First, I congratulate them. It is a very good investment. I'll speak in Telugu for their benefit. 18 నెలల పాటు మీ కుటుంబాన్ని వదిలేసి ఇక్కడికి వచ్చి ట్రైనింగ్ పొందటం అనేది కొంచెం ఇబ్బందికరంగా ఉన్నా ఇది మీ ఫ్యూచర్కి రాబోయేటటువంటి 20-25 సంవత్సరాలకి ఇది మీకు ఒక మంచి ఇన్వెస్ట్మెంట్. ఎందుకంటే ఈ కోర్సు చేసి మిడ్వైఫ్స్ కింద ట్రైనింగ్ పొందిన మీకు అందరికీ కూడా స్పెషల్గా వేరే క్యాడర్ క్రియేట్ చేస్తున్నాం. అంటే మీతో పాటు స్టాఫ్ నర్సుల కింద జాయిన్ అయ్యి ఈ ట్రైనింగ్ కోసం రాకుండా ఉండిపోయిన వాళ్ళు కానీ, ట్రైనింగ్ రేపు పొద్దున పొందని వాళ్ళు కానీ, వారికంటే మీకు అందరికీ కూడా మినిమం 1 నుంచి 2 ఎక్స్ట్రా ప్రమోషన్స్ వస్తాయి. దట్ ఈస్ వన్ థింగ్. అండ్ ప్రతి ప్రమోషన్ అంటే దట్ ఈస్ అడిషనల్ సాలరీ. ఖచ్చితంగా మీకు ప్రతి స్కేల్లో కూడా మీతో పాటు జాయిన్ అయినటువంటి నర్సెస్ ఎవరైతే ఉన్నారో ఈ ట్రైనింగ్ పొందని వాళ్ళకంటే మీకు అదనంగా జీతము ట్రైనింగ్ కంప్లీట్ చేసుకున్న దగ్గర నుంచి మీకు వస్తుంది. ఎందుకంటే ఇక నుంచి మిమ్మల్ని అందరినీ కూడా స్టాఫ్ నర్సెస్ క్యాడర్ నుంచి మళ్ళా ఒక స్పెషల్ క్యాడరు మిడ్వైఫ్ క్యాడర్ అనేది క్రియేట్ చేస్తుంది. మీరు మీ ఎక్స్పీరియన్స్ ప్రకారము 5 ఏళ్ల తర్వాత, 10 ఏళ్ల తర్వాత, 15 ఏళ్ల తర్వాత పీరియాడిక్గా మీకు అందరికీ కూడా ప్రమోషన్స్ వచ్చి మీరందరూ కూడా మీలో కొంతమంది మీరు రిటైర్ అయ్యే టైంకి ఖచ్చితంగా మీరు డైరెక్టర్ ఆఫ్ నర్సింగ్కి ఒక్క లెవెల్ కిందలో మీరు రిటైర్ అయ్యేటటువంటి అవకాశం ఉంది. అందరూ కాకపోవచ్చు, ఎందుకంటే ఆ పోస్ట్ ఒకటే ఉంటుంది. లైక్ డైరెక్టర్ ఆఫ్ పబ్లిక్ హెల్త్ ఉన్నట్టు మీ మిడ్వైఫ్ కూడా దేర్ విల్ బి 1 స్టేట్ లెవెల్ పోస్ట్. ఆ పోస్ట్లో దీంట్లో అనుమానం ఏం లేదు, ఈ రోజు ఈ రూమ్లో ఉన్న వాళ్ళే అవుతారు. ఎందుకంటే యు ఆర్ ద ఫస్ట్ బ్యాచ్, మీరు సీనియర్ మోస్ట్ అవుతారు, మీలోంచే వస్తారు. కాబట్టి ఆ ఆపర్చునిటీ అంతా కూడా మీకు వస్తుంది. ఇదంతా ఎందుకు చెప్తున్నానంటే మార్నింగ్ చూసినప్పుడు నా టపాల్లో ఒక లెటర్ ఉంది. ఒక అమ్మాయి, నేను ట్రైనింగ్కి రాలేకపోతున్నాను, నాకు ఎగ్జామ్షన్ ఇవ్వమని చెప్పి లెటర్ పెట్టుకుంది. అది చదివినప్పుడు నాకు నవ్వు వచ్చింది. 18 నెలల పాటు కష్టానికి మనం రాబోయేటటువంటి 20 సంవత్సరాలకు సంబంధించినటువంటి ఒక భవిష్యత్తును మనం ఎందుకు పాడు చేసుకుంటున్నాం? డెఫినెట్గా ఇది ఒక ఆపర్చునిటీ కింద మీరు తీసుకుని ముందుకెళ్లాల్సినటువంటి అవసరం ఉంది. ఇది పర్సనల్గా మీకు ఆర్థికంగా, అదేవిధంగా ఉద్యోగంలో హోదా పెరగటానికి కూడా 2 రకాలుగా కూడా ఉపయోగపడుతుంది. కాబట్టి మీరు అందరూ వచ్చినందుకు మీకు కంగ్రాచులేట్ చేస్తూ, దయచేసి ఎవరు కూడా ఈ 18 నెలల పీరియడ్లో మళ్ళీ వేరేగా వెళ్ళిపోదాము, అవ్వదు ట్రైనింగ్, ఇంటి దగ్గర ఏదో ఇబ్బంది ఉంది, ఇంటి దగ్గర ఏదో ఫ్యామిలీ ప్రాబ్లం ఉంది, ఇలాంటి విషయాలన్నీ కూడా మనం ఎక్కువ ఆలోచించకుండా ఈ 18 నెలల పాటు కూడా దీక్షతో ఇక్కడ నేర్పించేదంతా కూడా మనం నేర్చుకునేటప్పుడు మనకి ఏ సందేహాలు వచ్చినా, ఏ అనుమానాలు వచ్చినా, ఏది వచ్చినా నిర్మోహమాటంగా అడిగి నివృత్తి చేసుకోవాలి. అది చాలా ఇంపార్టెంట్. ఎందుకంటే అప్పుడే మనం ఆ సబ్జెక్ట్లో నిష్ణాతులు అవుతాం. మీకు ఇప్పుడు ఎవరు ఏది చెప్పలేనిది ఫ్యూచర్లో జరగబోయే ఒక విషయం ఏం చెప్తున్నానంటే, ప్రపంచవ్యాప్తంగా కూడా మిడ్వైఫ్స్కి రానున్న రోజుల్లో డిమాండ్ ఉంది. దాంతోపాటుగా మీరు ఈ ఉద్యోగంలో సీనియారిటీ వచ్చిన తర్వాత రాబోయే రోజుల్లో చాలామంది కొత్తగా ఉద్యోగంలోకి వచ్చే నర్సులకి ట్రైనింగ్ ఇచ్చేటటువంటి బాధ్యతలు కూడా మీకు వస్తాయి. అంత చక్కని ఫ్యూచర్ ప్రాస్పెక్ట్స్ ఉన్నటువంటి ట్రైనింగ్ ప్రోగ్రామ్ చేస్తున్నారు. కాబట్టి చిన్న చిన్న విషయాలకి ఇంటి దగ్గర ఏదో బాబు ఈరోజు స్కూల్ దగ్గర ప్రాబ్లం అయిందనో, పాపకి ఏదో ఇష్యూ అయిందనో దాని గురించి ఎక్కువ ఆలోచించకుండా ఈ టైం అంతా కూడా దీని మీద మీరు కాన్సన్ట్రేట్ చేస్తే అందరికీ కూడా భవిష్యత్తు చక్కగా ఉంటుంది. అదర్వైజ్ మీకు అందరికీ తెలుసు, స్టాఫ్ నర్స్ కింద ఉండిపోతే మీరు ఎక్కడ దాకా కెరీర్ వెళ్తారో మీకు తెలుసు. ఖచ్చితంగా మీరు మిడ్వైఫ్ ట్రైనింగ్ చేయటం వల్ల దానికంటే ఖచ్చితంగా 1 లేక 2 స్టెప్లు ఇంకా ముందుకెళ్తారు అక్కడ ఏదైతే పాసిబుల్లో దానికంటే. కాబట్టి శ్రద్ధగా ఇవన్నీ కూడా నేర్చుకోండి. సో దిస్ ఐ వాంటెడ్ టు కన్వే టు దెమ్ ఇన్ Telugu. I thought the message will go clear. All the other speakers who couldn't understand Telugu have to pardon with me. I was trying to express the prospects of this training, how it will be beneficial for them, how they are going to grow in the service and the cadre, and how much in demand they would be in the coming days. That's what I was explaining to all of them. Why? Because I believe in the principle of less is fair. There has to be something for every person for him to take up this activity and move forward. So that is the whole reason. And then I have few asks from the different partners who have come here. So 6 of the educators are not good enough for me. I'm not going to be able to complete all these things. And then the idea is that in the next coming 3 to 4 years, we should be able to train the required number of staff nurses that we should have. And our promise is that 100% from the state of Andhra Pradesh, we are committed. We'll go all the way along with you in ensuring that we take it to a logical conclusions. What I would be requiring is that at least 60 of the educators would be required. So we would be requiring this international educators coming in. Already, I think our proposal for having one SMTI Tirupati to become a training center for educators is already in the fast track. And one more SMTI also we are expecting that would be done. So both the institutes together, if they can give an output of 60 educators without compromising on the quality. Absolutely, whatever international level quality is there, if that quality is there. And we would require support from both Fernandez and also from UNICEF. And Fernandez, I have a special connection that my daughter is born in your hospital. Yeah, I was there. So I've seen you guys working and how you guys work and all. So I have a lot of respect for the organization as such. And UNICEF have always been our partners. And we hope this little ask of mine, because it is not little, it's quite a tall ask. So you would help us in doing that, because this is something which I cannot do. I don't have the competence, or neither I have the human resources to handle such kind of thing, because this is the first step for us. So over a period of next 3 to 4 years, I expect that around 2,000 in the government sector will be done. After that, I have absolutely no issue in opening it up to the private sector also, so that even the private sector can come to our nursing colleges. They can also get trained using the same, because once we get a good enough 60 educators are there, after 4 years they're available for the entire society. We need not just restrict themselves to the nurses of the government hospital. They'll also be training the nurses from the private sector, because roughly today half the delivery load in the state is taken care by the private sector also. They are also our partners. In fact, large number of our hospitals we are covered under the Arogyasri, unlike any other state. So any pregnant mother can even walk into a private hospital, get all the facilities, and totally financially covered by the government. That also we do. So that all the private hospitals are also our partners. So we also want to improve the competencies of the private sector also. But since I'm a little selfish man, I want the government sector to be given the benefit first, and then we open it for the private sector. This is an answer to a probable question that you will have. Why 60? What will you do after 4 years? Probably after 4 years, there are 4,000 more people to be trained. We don't mind training in neighboring states, even people coming from the northern part of the country, because we have no language issues. All of you know that we're good at English and we have no the language bias. We would be happy to train our friends from the northern part of the country also. This is for the ministry. So I'm saying that we would be open for training other states also. With these 60 educators that we have, probably for the next 15-20 years, we have enough training capacity available to take the ministry's initiative of the midwifery to the next level. That we do. Having said that, it's not that only on the midwife side that we are passionate about. We are also passionate about on other sides. In fact, if you see that, I want all my delivery facilities to be getting the Laksha certificate. I am very passionate about that also. This year, a large number of my facilities got certified under Laksha. And in fact, even if the delivery load is low, we will be pushing all the facilities to at least come to a status where the moment they have that minimum delivery load, they apply for Laksha and get it. We want to go for the quality first, and then when the quantity happens, automatically they get qualified for Laksha. So happy to say that almost, I think this year, 40 of our facilities this year got certified for Laksha. Out of the 54, which is the minimum number of 100 deliveries per month. But we are also taking up another a total of 240 facilities to bring that to a Laksha level, so that they are all available. And labor rooms, we are standardizing. Any facility which delivers even 25 per month, we are going for standardization. So the ministry's standard is something else, but we are going to levels below, and we'll be happy to even take it below that level to even 10, so that the labor room is standardized and HR is standardized, and we have midwives available, so that in the long term we have a good maternal health, in the sense that the services are given to them as a right, and in fact by their choice, not by compulsion, as may be happening. And definitely the outcome that we want are better infant mortality rate and maternal mortality rate. So why we focus so much on maternal mortality rate, infant mortality rate? I always tell everybody that it is like Project Tiger. If somebody asks me why foreign department is so much focused on Tiger, it's not about Tiger. It's about the entire ecosystem they are worried about. By having my maternal mortality and infant mortality at a very good level, it means that my hospitals are basically working. When they are working, they also take care of all other services apart from maternal services also. That is the reason we have a lot of, what you call fascination, or we are very focused on maternal infant. This year has been bad for us with COVID and all. I had a little bit of more maternal deaths because at the peak of COVID, with lakhs of cases coming in, a little bit of maternal health had taken a back burner to issues like vaccination could bring back to pre-COVID levels. I think it will take us another year to recover and get back to the pre-COVID levels. But it's been a wonderful journey, and it's been good that all of us have brought it to one first initial step. This is today's is just small baby step we are putting. As they say that there are miles to go, and probably I'm looking at the next 4 years, which are very critical for the midwifery initiative in the state, where we should be getting 2,000 of the people trained and certified. We are also looking at collaboration with the international midwifery initiative, so that our people are also certified at an international level, so that we are also having a larger global demand and all as we move forward. As you know that HR will become an issue in most of the advanced countries with an aging population. So India would become the place in which to supply a lot of HR to other countries. And per se, that is nothing wrong. So that's the way the markets will operate. So I take this opportunity to thank everybody who is participating virtually and physically for having taken some time of their busy engagements, and particularly from the ministry. Ma'am has come all the way from Delhi, and others have joined from Hyderabad. I thank all of you for having come, and we hope this journey over the next 4 years would be a roadmap that today we are starting, would be a fruitful roadmap that what we have envisaged for the state and for the initiative for midwives and all goes with logical conclusion. Thank you.
Thank you so much, sir, for that wonderful and motivating speech and sharing your thoughts, how you are going to take forward this midwifery initiative in the state of Andhra Pradesh. Indeed, it is very clear that government of Andhra Pradesh will show the way to many other states with respect to implementation of this midwifery service. Thank you so much, sir, for your sharing your thoughts. Now, I would like to congratulate all our midwifery educators and the NPM trainees who have been selected and becoming a part of this first batch of NPM. Now, we request you, sir, for issuing the learning kit. We have prepared a learning kit which they will be using for the next course of 18 months, which included all the test book and the curriculum. So we request sir and other dignitaries on the dais to issue to some of the NPMs. Now I request NPM trainee Sri Lakshmi to come and receive the learning kit. Sir, please. Now I request our JC Rajan Kumari ma'am to issue the learning kit to Priscilla. Ms. Priscilla, please receive from JC ma'am. Now I request Dr. Evita to please issue to Sumalata NPM training. Now I request Dr. Salima to please issue a learning kit to Swarna. Now I request Dr. Rati to please issue a kit to Sirisha. I request Dr. Vijaya Gauri, Regional Director, to issue to Sailaja NPM training. Thank you so much, dignitaries, for issuing this learning certificate. Now I request BD Madam to give one of the kids to NPM training. Thank you. Thank you, each one of you, for issuing the learning kits. We have come to the end of the program. We immensely thank all our dignitaries for being here physically, and all the officials from the state and regional level and the district level, and of course the educators and the principal of this College of Nursing for making this ceremony a big success. We have come to the end of this program. Now I welcome Principal in Charge SMTI Guntur, Dr. Sugandhi, who is trying her best along her team to implement this training program as per the expected standards, to give a vote of thanks and close the proceedings formally. Over to you.
I want to say one saying before closing this session. A poet, Bharatidasan from Tamil Nadu, enlightening the knowledge of women will enlighten the family. So a healthy woman gives healthy child to the society. So we could develop the nation with health and wealth. So this program, enhancing the woman education, as well as a midwife will give the maternal and child health care. She is preserving the life of mother as well as the child. So thank you for giving this opportunity to stand in front of you at the closing session. It's my privilege to stand in front of you at this auspicious moment, that is a launching of Nurse Practitioner Midwifery course program. So I thank firstly Sri Bhaskar Katmani, IAS Commissioner of Health and Family Welfare, who encouraged at the back and to all the way and established this program with his enormous interest about this program from Government of Andhra Pradesh. Out of his busy schedule, Sir present over here throughout the program and make it this launching meaningful and colorful to the NPM trainees and program. I extend my heartfelt thanks to beloved Sir, Additional Director of Anil Kumar, who for each and every moment how to be proceed this organizing the program. So a special thanks to this moment to Sir, and extend my thanks to the Deputy Director of Nursing, Dr. Valli Madam, who has given a guidance to us to be conduct this program. Sorry, I am missing the order. And I extend my thanks to Dr. Evita, Chairman of Fernandez Foundation, who has guided us in the beginning for establishing the program, how to be scheduled the program and guidance material, what are all the things needed for the initiating the program. She has directly, indirectly, from the midwifery educator training program onwards, she is helping us to the institution. I extend my thanks to you, madam. I express my heartfelt thanks to the UNICEF representatives who also, at my bottom of heart, who helped the program all the ways to be successful. I express my thanks to Dr. Dilip Kumar, President INC, and Dr. Lugi D. Aquina, Chief Health, UNICEF Health of India. So they were virtually presented and expressed a lot of information, how it is worthwhile and important, the midwifery program to the society. Thankful for them, virtually present all over here. And express my thanks to Dr. Rati Palachandran, Additional Director of Nursing and Ministry of Health and Family Welfare. She is so kind of, and in the morning she has encouraged us. Thank you, ma'am. I express my heartfelt thanks to the Regional Director of Health and Family Welfare, Dr. Vijay Gauri, madam. She also so kind of when we are given the invitation to the situation. So especially expressing this program on the occasion, I express my thanks to DMNHO and staff, and to all the people who are presented over here, and special thanks to Medical Superintendent from GGH, Dr. Prabhavati madam, when we expressed the training and all, and HOD of Dr. Venkat sir. Also, they were supporters because our NPM educators were participated already in the hospital for initiating this program. They were guided us. Thank you, sir. And I congratulate all the NPM trainees who are all over joined here with the initiativeness and your own willingness. So as sir said, you have to be used. That means what? You are so beneficial through this program in future. Thank you all. And I express my heartfelt thanks to the Joint Collector, madam. So, madam is so simple. I have seen previously in the World Cancer Day occasion also. Very simple, and she is so supportive. And thank you, madam. You are present here all over the way. And express to the thanks to the media, and you are present here. And I express special thanks to my faculty and midwifery educators who are all supported me to make this program in the successful way. Thank you, one and all. Because still 3 days we are doing so many things, because our institution is one of the examination center. Any mistake in between this program, please pardon us. Thank you, sir. Thank you all. I express thank you, one and all.
Thank you so much, Dr. Sugandhi, for the elaborate vote of thanks. Thank you, one and all. Have a great day. It's 5 minutes.
Thank you.
So close అయ్యాక ప్లేట్ తీసుకొని అది అయిపోయాక ముందు పెట్టండి బ్యాక్ స్పీచ్ తర్వాత తీసుకుంటాం కెమెరా